Hi, I'm Simone Darouge. I'm a senior researcher with the Department of Family Medicine, and I'm situated within the Bruyère Research Institute. My project is about helping people in the community access resources in the community that can help benefit their health and help them achieve their health goals. So it's an intervention that relies on a patient navigator to support patients reach the resources for which they have a need. So the patient navigators in our program are lay individuals. That means they don't have a medical training. They are somebody who has really good people skills. They can interact with folks. They're trained in motivational interviewing, which is an approach that is meant to encourage the individual that you're talking to sort of find the solutions and empower them to take the steps that they need to take, whatever those steps are. So in our case, it's to engage them to use the resource that they and their family physician had determined would be beneficial to them. This intervention, this navigation model that we've developed came about from a consultation that we undertook in the LIN about access to primary healthcare. Where are the gaps? What are the issues? What is it that these community members here are not able to access in terms of primary healthcare services? So we were told, well, use the community resources. And the interesting thing is that the patients who need these resources the most are those who have the most barriers in accessing them. Our next step is actually a randomized control trial where half the patients are going to get the navigator and the other half are not. And that'll really allow us to understand the impact of the navigation model that we have right now. And that component of the study is especially focused on understanding the equity and access to these services across the two primary Canadian language groups, so French and English. So we're interested in the experience of Francophones living in minority situations, as they do in Ontario. But our study is going to recruit both groups or any patient population, but our analysis is going to have that equity lens across a number of facets, but language is going to be a primary one.